presenter. The titles, awards, and the honors that he has added to his profile is not just wonderful, but awesome. I believe more than 75% of the Bahrain population knows him through his multiple roles. Basically, he's a family practitioner and the head of SAAR, Medical and Dental Center, American Mission Hospital, AMH. Physician head of the Community Outreach Wing and the head of Smoking Cessation Clinic of the AMH. Vice Chairman of the Indian Community Relief Fund. To add with, he is the coordinator, ICRF Life, a mental well-being support initiative of the ICRF, and the president of the Indian Medical Association, Bahrain, and also he is a member advisory board, Science India Forum, Bahrain. His passion is empowering people. Presenting the very vivacious and vibrant leader, distinguished Toastmaster, Dr. Babu Ramachandran from Bahrain to speak on From Illness to Wellness.
Thank you, Toastmaster Adira, for those very, very wonderful words of motivation. You really imparted a positive atmosphere to the whole crowd right from the time you appeared on the screen. Thank you. I think I can see the timer. Should I pin the timer? Let's see.
Doctor, I will highlight you when the green screen comes on your screen.
Sure, please, please. That's better. That's better. That'd be better.
Thank you. Thank you.
Well, good evening, distinguished district, division, area officials, fellow participants of this wonderful workshop, which is being organized by Area 16. It's my privilege to be here today, and my gratitude to Toastmaster Thomas, the photographer come laughter yoga expert come teacher, for this opportunity given to me to be here to share something about wellness. It's a challenge to speak to Toastmasters because I know that every eye will be watching for evaluation, and that makes the challenge more profound. However, let me try to share something to you about the concept of illness and wellness. See, years back, when we looked at an illness, or when the generation of old, our grandparents, great-grandparents, and so on, they had the concept of illness. That is, you are ill, you go to the hospital, you take treatment, and you come back. But now that has changed. And we are more focused on remaining well throughout our life. And it's from this that the concept which I have shared here originates, from illness to wellness, the I to we approach. Earlier, it was an individual effort to maintain health. Today, it's a team effort. It's not just one person who is involved. It's we, a combined effort from the healthcare providers, the paramedical staff, the community in general, and the powerful, motivating speakers in Toastmasters and the members who impart a positive vibrance to every person to remain well in life, empowering people. So it's always a wellness concept that is important. So how do we look at the future? What do we see in the future as far as health is concerned? I'm not going to dwell on illnesses that are common here, the treatment and so on, because now Dr. Google and Dr. Yahoo are at the fingertips of everyone, and you get innumerable solutions for the illnesses that are there. And I'm not going to dwell too much on the pandemic. I'm sure you are overdosed with a pandemic of information about the pandemic, which has taken the whole world by storm. See, what is the future of healthcare? I was going through an article by McKinsey, which says, the hospital is dead, long live the hospital, done by a series of authors. Yes, you see, the concept or the idea that the hospital is a place where you are sick is slowly changing, where healthcare reaches out to the community. The healthcare providers tell others on how you should remain well. It's not just medicines alone that matter. How does the community perceive future healthcare? There are higher patient expectations with the changes in patient population. There is an increase in the older generation. Longevity has increased, but the expectations too have increased. Many types of cases are there in the community healthcare settings, where the healthcare provider reaches out to the community and guides them on how you can become well, how you can retain your health throughout life. And added to is the advances in clinical knowledge and technology. All these contribute to the concept of wellness because expectations are there by each and every one. From the cradle to the coffin, the desire is there to maintain good health. And earlier, from the joint family system, which was there maybe generations back, we are now into the nuclear family setup. So that we depend mostly on the community to come together when we are sick. And the idea is to stay in a state of well-being and not ill-being. The impact of digital technology on how healthcare is developed, that is going to play a crucial part in the future. The financial and funding challenge. So all these are contributory factors to help people or the expectations of people to remain well throughout life. And that's the challenge of the healthcare profession. And people want quality care at affordable cost. To remain well, as I said earlier, it's not just treating a patient with medicines. 3 factors are important, which I have learned over a period of time: compassion, grace, and love. You have to treat patients with compassion. You have to have that grace to treat them, and you have to impart love. Because more than medicines, this sends a vibration into the other person who treats you. When I see patients in my clinic, what they come for is not just medicines. They don't come for a 3-minute consultation for an upper respiratory tract infections where medicines are given. No, they come because they want to share their problems, not just medical, but also non-medical. And that's where the healthcare provider's role is very important. It's really the decision of the healthcare provider, not just to treat them with medicines, but to help them come out of their problems and bring them back into the mainstream of life. As I said earlier, the patient population is getting older, and the patients as well as families have higher expectations than before. And in the journey from illness to wellness, we have to involve families in decision making. Primary preventative care is paramount to well-being. It's said that an ounce of prevention is better than a pound of cure. As technology advances, I've seen that the number of illnesses that are affecting the people globally are also increasing. And added to that is this pandemic that we are going through. No talk is complete today without shedding some light on the pandemic. Living with COVID-19, is there a way out of this? Is it here to stay? Questions which people ask me. I would not dwell too much on the pandemic, but still, let me tell you that there are technologies now which will help you to remain in a state of wellness, where there is the enhancement of connectivity between the patients and the healthcare. Telemedicine is here to facilitate consultations where from any part of the world, you can get advice from expert healthcare providers. The world has become a global village where technology is at your fingertips. And here is where we need people who have doubts about their wellness to get in touch with the providers from different parts of the world if they want to clear their doubts. Never harbor doubts in your mind. Dear listeners, this is a message which has to be sent out to the community. If you have a doubt about your health aspect, definitely what you need to do is reach out, clear your doubts, not relying on WhatsApp messages and the social media alone, but get authentic information. And now the question comes, where do I get authentic information? That's where trust comes. Trust the healthcare provider, the doctor, the nurse, or whomever you are addressing your concerns to. And in healthcare, there is what is known as the triple T, which is trust, transparency, and teamwork. This is what is going to enable people to remain well as in the journey of life. So what do we do to remain well? Do we go in for checkups regularly? I would say that for a simple cold, for just having a mild fever, I wouldn't say rush to the hospital. But from at the age of 40 and above, I would advise a comprehensive medical checkup. I'm not going into the other aspects of health, which is mental, social, and physical well-being, and not just the absence of disease of infirmity as defined by the World Health Organization. You need to have your checkups done so that you understand the risk factors that you have. Maybe a check of the cholesterol levels, the sugar levels, maybe an assessment about any other complaints you may have, like, let's say a simple abdominal pain can be discarded, but if it persists, go for a checkup, because there is technology today to identify and find out what you are suffering from, and to take the first step to prevent any illness from overpowering you. So this is of paramount importance for the whole population, gents and ladies. For ladies, as we know, it's always good to have a preventive checkup after the age of 40 with maybe a mammogram, a pap smear. Well, the list is endless and you don't need to go into everything, but a proper healthcare assessment or a proper health assessment will enable you to go from the realm of illness to the realm of wellness and to maintain it. I'm not saying that you should avoid all the good food items in life. I'm not saying that you should exercise throughout, because these are some of the questions which people ask me. Do I have to exercise 30 minutes, 45 minutes? Do I have to cut down on all good things? Do I have to take medicines regularly for life? It all depends on what your physician advises you. Never take medicines because the other person is taking that same. In a speech, maybe you can adapt things which are taken from another person. But in the healthcare setting, don't say because somebody has taken paracetamol for a headache, when I get a headache, I too will take paracetamol. I have seen people coming into my clinic holding a bag of medicines, ranging from psychiatric medicines to medicines for blood pressure to eye disorders, sleep disorders, just for a simple headache, which could have been solved by visiting the ophthalmologist. The reason why people go into that sort of remedy is because they believe in the phenomenon of, I have taken it, you also take it situation. Don't go in for that. A few words about the pandemic as my time is coming to a close. Don't be afraid. This pandemic is not here to stay. There was a pre-COVID time. There is light at the end of the tunnel. What is the solution? Are there going to be medicines? Are there going to be vaccines? Time alone will tell. The mask will have to be a part of your attire at least for the next 6 to 9 months. Once the vaccines come in, we may have a solution for that. Don't go in for all the remedies that are there, like drinking ginger in the morning, tea in the evening. So many advices are given. I know a patient who called me and told me, morning I take a glass of lime juice with ginger. Afternoon, I take 2 more glasses of the same. I take vitamin C, vitamin D, do some breathing exercises, and now I'm having an abdominal discomfort due to the acidity problem. Don't go in for all these sort of things to get out of the pandemic. Relax. And as laughter yoga expert Thomas will tell you, you just need to do some breathing, have a positive mindset approach. And even if you turn out to be COVID positive, don't panic about it. It's a passing phase. It will die its natural death. It's not that devastating that every person with COVID-19 will go down the line. No, it won't. Earlier, the medical profession did not know how to handle this because it was a simple virus unheard of. Now we are getting into terms with what we can do to get out of the situation. And there is light, there is hope. Don't be worried about your health problems because you live only once. And if you live right, once is enough. That is the message I want to tell you. Forget all your illness, stay towards wellness, do your tests as and when needed, and wish you all a healthy, happy, and fruitful life. Thank you very much. I've tried to concise in a nutshell some information, but as you know, in the pandemic of papers on healthcare, it's difficult to concise it. But I appreciate the opportunity given to me. Thank you. Back to you.
What an amazing session, distinguished Toastmaster Dr. Babu. We owe you huge thanks for adding to our wellness improvement plans. It was great listening to you. Now let me call upon the moderator to conduct the Q&A session.
Thank you, Dr. Babu. What a great presentation. Your nutshell was more nutritious than nuts, which is very nutritious to our health.
Thank you.
So coming to our questions, there's a first question. You started with great message, compassion and grace and love. I really liked it. And also you said the treating patient should be trust, transparency, and also teamwork. That's a great message. Now we have a first question for you from DTM Lee Jean from Malaysia. What she says, medicines are so expensive nowadays. How to afford and are generics okay?
Thank you. Thank you for that question. You see, it's a question which has got a lot of meaning because, you know, there are generics out there in the market and there are branded products. Many of the generics are really good, and they are cheap as well. But the unfortunate part is, world over, some of the generics are not as effective. I was reading a book called A Bottle of Lies, where one company is being highlighted on the wrong things they did. So generics do have a problem, and there's not going to be a perfect solution. But that doesn't mean that all branded products are that good, and you must go to branded products. You should take generics when needed because the cost factor matters. I cannot tell you which generics are good and which generics are bad, but healthcare is becoming expensive. That's why we need to remain in a state of good health by following wellness and not trying to fall ill. I suppose that answers my question in part.
Thank you. Thank you, Dr. Babu, for that answer. Any other questions from audience? Okay, till other questions come, I have one question, Dr. Babu. We always say absence of illness is a wellness. Always we feel that. But my question to you, many things we can control, but there are some genetic factors we cannot control. We get diseases.
Yes, yes.
So my question to you, being ill, how to be well? That's
Being
because being ill, because this is a lot of, everybody has got comorbid condition, genetic
correct.
condition. How we can maintain wellness in spite of being ill?
You see, once we know that there is a family history of, let's say, some diseases which come to us through that, it's good to have some precaution. But that doesn't mean you should overdose yourself with precaution. Like people say that my parents were diabetic. So from my childhood, I stopped eating sweets. I would say that you have lost your life by not eating sweets. Enjoy your life. Cross the bridge when you come to it. Have a little precaution and have it in mind. Don't go ahead thinking, oh, my parents have got heart disease, so I will get a heart disease. No, it's not like that. Genetics do play a part, but moderation, that's what is needed. But don't overdose yourself with all the advice that you get. And I repeat, cross the bridge when you come to it.
Thank you. Thank you, doctor. Wonderful answer. So key is precaution and moderation to
Correct.
be well even when you're ill. Thank you very much. That's a great message. Any other questions, please? Okay, I have one more questions. Now we are going out with pandemic. You have described very well what are the precautions and everything. Can you tell us 3 sutras or 3, ideas how we take care ourselves and our surroundings in this tough session? 3 simple ideas.
First and foremost, always remain positive. I don't mean COVID positive. I mean positive in your outlook to life. You just remain positive in that outlook. That is number 1. 2, if you feel that you have got some illness, take some authoritative advice, somebody who can help you with that, and reach out to your families which you have not been in touch now. This is the best time of the pandemic to learn new skills. To, like, even on this, you can be in touch with people around the globe. Take this time to really be in touch with others. So those 3 things: proper eating, proper exercise, and remaining positive in your mental approach to life.
Thank you, doctor. That was a very important key lesson. Be positive, take advice, reach out, and 4th one is develop your skills. These are the 4 are very important 4 things you told me. Very interesting. Thank you very much, doctor. We conclude our question answer session, and we really enjoyed your first session of wellness. Thank you very much for being with us. And same time, we'd like you present a token of gratitude for your time with us today and taking us through this wellness journey. So Dr. DTM Babu Ramachandran for the enlightening presentation and at wellness seminar organized by Area 16 Division C District 20 of Toastmasters International, we present you this gratitude.
Thank you. I accept it as a token of wellness over illness.
Thank you. Thank you, doctor. That's wonderful. Thank you very much. Let